Hello everyone, I hope you're all in good health. My name is Vimal and I'm the CEO of LiYF Limited. LiYF is a healthcare company that specializes in premium healthcare supplements for weight loss, for fertility, cell protection and PCOS. Our aim is to help people tackle everyday health issues with natural products rather than using chemical-based medicines. As you may be aware, coronavirus is around. COVID-19 is a viral pathogen that causes severe morbidity and mortality. To date, there is no approved or licensed vaccine or antiviral medicines that can be used to prevent infection, that can be used to treat COVID-19 infected patients, or even be used for their aftercare when they recover. We at LiYF, we actually believe that prevention is better than cure. And so we have decided to share the results of our findings as a group of preventions and treatment protocols. The team at LiYF have been working with task forces around the world to research COVID-19. And I feel it's our duty to share this information with you, which hopefully benefits you during these very concerning times. We have found several clinical studies, documents and fact-based evidence which confirms that natural remedies and personal habits can significantly improve your body's immune system and also significantly help your body to fight the virus. Please note, these prevention and treatment protocols are not a cure. They're not a vaccine or treatment for COVID-19. We strongly advise you to follow medical advice and also government guidelines. As I've already said, there is no cure, there is no vaccine, there's no treatment for COVID-19. And hence, as a healthcare company, we've been asking the question, what can we do to protect ourselves? What can we do to stay healthy? We believe there is more than enough compelling data supporting alternative, complementary and natural supplements and even specific personal habits that can protect you and also reduce the impact of coronavirus on your body. Looking at the data from China, we found that 80% of infected people have minimal symptoms and do not seek medical attention, whereas 15% become moderately to severely ill with a persistent cough, shortness of breath, and 5% require intensive care. About half of these Chinese patients admitted to hospital do not have a fever, and a fifth failed to develop a fever despite having pneumonia. So unlike with influenza, the presence or absence of a fever is not a very useful diagnostic aid. COVID-19 appears to spread rapidly and readily from person to person, usually as droplets from coughing or sneezing. We also know that COVID-19 is also shed in stools and persists in stools even after respiratory swabs have become negative. So foodborne or waterborne infection is possible, but not yet demonstrated. Coronavirus also remains viable on surfaces for several days, but the spread of infection from touching contaminated surfaces has also not yet been demonstrated. This being said, it is very advisable to clean surfaces to minimize the risk of infection. What else do we know? The incubation period from exposure to COVID-19 is 2 to 14 days, with an average of around 5 days. Unlike the flu, illness from COVID-19 appears to start gradually with fatigue, aches and pains, and a sore throat. These symptoms typically last for 5 days and are followed by recovery. The loss of smell and taste have recently been reported to occur in about half of people with COVID-19. The milder illness is phase 1, and for 80% of people, it is the only phase. For 20%, however, phase 2 starts after 5 days, with a persistent cough, shortness of breath, and symptoms of pneumonia as COVID-19 attacks your respiratory system. Because people who are infected, but also not sick, they are able to infect others. So widespread dissemination is likely. For this reason, healthy young people need to take the same precautions as their parents and their grandparents take, if we stand a chance of controlling this pandemic. Although we are at risk, young and old, mortality increases with age, and it is greater in people with underlying health issues such as high blood pressure, diabetes, and heart disease, to name a few. So it is vital that we protect these people. It is not presently known whether recovery from infection of COVID-19 produces immunity to the virus. There are cases reported of apparent reinfection, but they might represent a flare-up of an infection that had been suppressed but not cured. So once again, what can we do to protect ourselves? And what can we do to stay healthy? The first step is to develop some good habits. Wash your hands. Wash your hands with soap and water for 20 seconds before eating, touching your face, after being with other people, and when you return home. A face wash is also a good idea. Soap is the ideal anti-coronavirus cleanser because it destroys the virus's protective envelope. Do not use antibacterial soap. It does not kill the virus, and if anything, it's going to damage your skin's microbiome. Use caution with objects or surfaces that are possibly contaminated. Avoid touching metal surfaces, doorknobs, or elevator buttons with your hands. The following cleansers will kill most viruses, including coronavirus, on hard surfaces, as long as there is 30 seconds of contact. So 70% alcohol, 0.5% hydrogen peroxide, 0.1% bleach. But if you choose bleach, make sure you do not mix it with ammonia because the combination produces a deadly gas. Hand sanitizers with 70% alcohol might be an adequate substitute for soap. But remember that the contact needs to be maintained for 30 seconds. Clean doorknobs, mobile phones, keyboards, your credit cards, clean them daily or even more frequently. If you are sick, stay at home. Stay at home, wear a surgical mask around other people. When coughing or sneezing, cover your nose and mouth with your forearm, cough into your elbow. If you use a tissue, dispose of the tissue immediately into a closed container. Avoid shaking hands. You can always use namaste. Social distancing is in place in many parts of the world to prevent the virus from spreading. Try staying 6 feet away from other people, especially if you are sick. Only leave the house when it's absolutely necessary to leave. A very good tip is gargling. So gargling with most readily available mouthwashes, or if you can't find a mouthwash, a mix of toothpaste and water. This can help kill the virus in the throat before it enters the system. And this is because they contain suffocants, compounds that lower the surface tension. So it is a good precautionary practice to do this several times a day, especially when leaving the house or returning home if it's absolutely necessary. quarantines put in place will delay the spread of the infection and reduce the burden on the healthcare systems around the world. But unfortunately, we believe most people are likely to be exposed to COVID-19. If you are exposed, there are measures you can take based on the biology of the virus, which may diminish the likelihood of severe illness. They are not treatments for disease. They are preventative strategies to place you among the 80% with mild to minimal illness. The 80% who have the greatest chance of success if these measures are implemented before you are exposed. So, once again, what can we do to protect ourselves? What can we do to stay healthy? Number one, sleep. A good night's sleep is necessary, as this is when your body produces melatonin. Melatonin is an anti-inflammatory and has potential use in adjuvant therapy for COVID-19, as recently proved in a study. Your body makes melatonin in the dark at night, and children make much more melatonin than adults, which is one of the reasons why they may be resistant to the illness from COVID-19. Number two, exposure to the sun. Exposure to the sun is the best way to produce vitamin D naturally. Vitamin D is crucial for the body's immune system. The University of Edinburgh team focused on how vitamin D affects a mechanism in the body's immune system, and researchers say the findings shed light on how vitamin D deficiency may regulate the immune system and influence exposure to autoimmune diseases. The World Health Organization recommends 10 to 30 minutes minimum sunlight per day. But please, if you go outside, maintain social distancing. Number three, meditation. Practicing meditation has several benefits, including reducing the severity of psychological disorders and stress-related ailments, increasing immune function, and delaying the progression of various diseases. The benefits of meditation is nothing new, and it is part of the Vedic tradition of India, stretching back several thousands of years. It is at the heart of the yoga system and an important part of Ayurveda. Ayurveda means the science of life. Ayurveda is the world's most ancient system of natural healthcare and personal development. Number four, fasting. Several clinical studies confirm fasting improves the body's immune system. It's quite simple. Practicing intermittent fasting followed by alternate day fasting is recommended. The New England Journal of Medicine states that fasting can trigger a metabolic switch from glucose-based to ketone-based energy, with increased stress resistance, increased longevity, and a decrease incidence of disease, including cancer and obesity. Number five, exercise. How does exercise help? For one, physical activity helps flush bacteria out of the lungs, decreasing your chances of getting the cold or flu or other illnesses. Exercise also reduces levels of the body's stress hormones, such as adrenaline and cortisol. Exercise also stimulates the production of endorphins, chemicals in the brain that are the body's natural painkillers, and also mood elevators. The National Center for Biotechnology Information clearly states that regular aerobic exercise are associated with improved ACE2 function. This is the receptor for COVID-19. 6. Yoga. People who have been practicing yoga, meditation and pranayamas have experienced a higher level of immunity and also lung strength, making it difficult for the virus to affect their bodies. Yoga asanas are a good way to improve your body's physical fitness, but they don't just work on improving your flexibility or helping you lose those extra kilos. There are specific yoga asanas that can help boost your immunity as well. I'll place some links in the description for some very simple yoga asanas that you can all try. Prana. What is prana? So prana is the life force in our body. Pranayama means the exercise of increasing the life force in our body. By increasing our prana in our body, we can tackle many diseases and even prevent them. Simple things like Ujjayi breathing or victory breathing. Ujjayi breaths are the full yogic breaths where the focus is on taking the breath through the base of the throat, instructing the lungs to increase the intake of oxygen. Nadi Pranayama, the alternate nostril breathing technique, is a very simple pranayama which calms the mind, recharges your body and leads it into meditation. Once again, I'll place some links into the description which will show you how to do these. These are very simple exercises that can rejuvenate your body. While we're talking about breathing, there are several. Number 7 is that actual breathing techniques. So there is a gentleman by the name of Dan Brule. He is a world-renowned pioneer in this field of breathwork. Most of us breathe in and out at least 23,000 times a day without skipping a beat or paying it any attention. Breath is life. It's something we can all do better. So for example, go for the triple whammy. Make a mental map of your body divided into 3 spaces. First is the lowest section, stretching from your pubic bone to your belly button. Next, the middle space is from the belly button to the nipples. And finally, the upper space is from the nipples to the chin. Separate these spaces in your mind and try to feel from the bottom up in your breathing. Don't breathe back to front. There's no reason why you can't breathe out before inhaling. A simple change like this can reveal a lot about yourself. Instead of in then out, try out then in for a few minutes and see how you feel. Breathe away stress. Slow and low breathing will help rid you of stress and you will become calmer. Popular ways to do this include lengthening the pause between breathing in and exhaling, or the other way around, if that suits you better. Another method is stretching each inhale and exhale for several seconds. Positive breathing. This involves combining positive thinking or affirmations with a breathing ritual. When inhaling, tell yourself you are relaxed. Then on exhale, think you are peaceful. Other feel-good phrases pairs are I'm healthy and strong and I'm free and safe. But you can make up your own phrases, but keep them positive. Breaking the silence of breathing. Try making a noise when you breathe. Not a loud outburst, but a calm and soothing sound, such as the wind blowing through the trees or the sea gently lapping on the shore. Breathe in through your nose, but out through pursed lips. You can change the shape of your mouth to change the sound. There are more details about breathworks and the works of Dan Brule and Wim Hof and many other people who are experts. I'll put them into the description. Number 8, diet. So a few natural products have shown anti-coronavirus effects in laboratory studies, including results in animals. Some of these have a long history of human use for treating infections. Plant-based whole food diets are associated with improved ACE2 function. A balanced diet plus the following foods can help immunity and help in the prevention of COVID-19. So we should all be aware of vitamin C. It's very good for your immune system. So the next one is amla, popularly known as the Indian gooseberry. It is quite regularly used in the Indian tradition. Amla is an antioxidant and a rich source of vitamin C, which is very important for boosting your immunity. Since it is a fruit, amla can be eaten raw, or it can be taken as juice, or even consumed as part of a health supplement. Other things you can take are like guavas, oranges. There is also amrut, also known as giloy. Amrut is an immunity enhancer. It is available in the market as a herb and tablet form. So next one is asafoetida, or hing, as we call it in Indian. This is a Chinese herb which has been used in China for the treatment of COVID-19, along with other herbs as well. There is also tulsi, also known as basil. The tulsi herb is very effective in treating upper respiratory and lower respiratory diseases, such as coughs and colds. It has antibacterial and antiviral properties. You can consume tulsi leaves directly or consume them in the form of a herbal tea. Turmeric. Turmeric is a common ingredient in every kitchen, especially Indian kitchens, and it is part of most home-cooked meals. It has anti-inflammatory and antibacterial properties and has the potential to prevent diseases such as cancer, Alzheimer's, and heart diseases. But the best thing about turmeric is that it gives a massive boost to your immune system. This is another thing that should be consumed daily. You can buy turmeric powder and drink it by adding it to milk or as an ingredient in cooked food. Black pepper is another spice. When consumed with turmeric, it boosts immunity and prevents the body from contracting any form of cold and, in effect, the coronavirus. Another very good tip is to reduce your sugar intake. Sugar reduces your body's immunity levels. It's quite simple. So then you have quercetin, a flavonoid found in apples, onions, and many spices. And another food you can have is grounded flax seeds. So the lung damage of advanced coronavirus pneumonia is due to an overactive immune response. These immune boosting therapies should be used for preventative or early infection only. They are not to be used for severe illness. Okay, so some possible supplements that you can take. Now, these supplements may address the biology of COVID-19 and also the human immune response. Once again, these are not treatments for infection or disease. They are supplements. So supplements that can help to kill the virus. So asafoetida or hing, you can get them as tablet forms in most health or Ayurvedic shops. For supporting ACE2 in COVID-19, curcumin 500 milligrams and resveratrol twice a day. Rosmarinic acid 140 milligrams twice a day with food. Alpha lipoic acid 300 milligrams twice a day with food. For mTOR inhibition in COVID-19, resveratrol, very good. Quercetin 300 milligrams twice a day with food. For the inhibition of 3CL proteins in COVID-19, elderberry. There are many preparations and they work best if taken before exposure and during the early stages of infection. The dose will depend on the preparation that you can find. Products should state flavonoid or anthocyanin content, and dose is 400 to 600 milligrams of flavonoids a day. But please stop elderberry if you are sick for more than 3 to 4 days. You can also take fresh ground flax seeds, 1 to 2 teaspoons a day. Elderberry extract we've already discussed, and that, as I say, that is very good, but be careful, only 3 or 4 days. Vitamin D, you can take anything between 1,000 to 5,000 IU a day with a large meal. So to enhance your innate immunity, vitamin C, if you're not getting it in your diet. Vitamin D3, as we said, 1,000 to 4,000 IU daily. Curcumin, 500 milligrams, preferably with pepper or high bioavailability like BCM 95. Giloy, melatonin. I've already spoken about these things. You can also take antioxidants such as CoQ10 or ubiquinol, resveratrol, zinc, vitamin C and vitamin D are also very good antioxidants. So we have RevitaLiYF UBQh-R. So RevitaLiYF UBQh-R is a synergistic blend of ubiquinol and resveratrol. Ubiquinol is the reduced and more bioavailable form of coenzyme Q10. Ubiquinol's primary role is in the synthesis of energy in the form of ATP. And as a protective antioxidant, it is considered as the strongest lipid-soluble antioxidant synthesized in the body, providing an active defense against oxidative damage to lipid proteins and DNA. Resveratrol, extracted from black grapes, is considered one of the best water-soluble antioxidants. Antioxidants are generally classified in 2 broad categories: water-soluble, hydrophilic, and lipid-soluble, hydroproliferative. Our body needs both types of antioxidants because each one targets different types of cells and tissues for free radical scavenging. So we have water-soluble antioxidants. These are present in aqueous fluids such as blood and intercellular and extracellular fluids. These react with oxidants in the cell cytose, fluid portion of the cytoplasm, and the blood plasma. Resveratrol is considered one of the best water-based antioxidants. And then you have lipid-soluble antioxidants. These are localized to cellular membranes and lipoproteins. They protect cell membranes from lipid peroxidation. Ubiquinol is considered one of the strongest lipid-based antioxidants. The body needs both types of antioxidants to fight and help neutralize these pesky free radicals. So as your body needs both types of antioxidants, and when you take them together, the efficiency of water-soluble and lipid-soluble antioxidants is very effective in increasing the body's natural energy. And energy makes you function better. Finally, as LiYF, we are currently in contact with the MHRA and the EMA regarding what we believe are the positive effects of RevitaLiYF UBQh-R on coronavirus, and we will keep you posted on our progress with this. I'd like to thank you for your time. The main aim of this video is to empower you. We want you to live a longer, healthier life, and hopefully this information creates a positive influence on your well-being, especially during these unprecedented times. Our health is of vital importance. Please keep in mind that we all can live a healthier life. Follow medical advice and government guidelines on COVID-19. But most of all, stay safe, stay healthy. Please look after yourselves, look after your loved ones, and those that are vulnerable and in need. Thank you very much.